And there we go, we're recording. And I'm going to pass it over to the moderator for our panel discussion, Emily Chan. Emily is a lawyer at the legal clinic Justice for Children and Youth in Ontario and a board member and treasurer for the CCRC. And she will introduce our panelists here today.
Hi, everyone. So we have a couple of glitches, but I think we've worked out most of them. Who we have today is was supposed to be Zoe Craig-Sparrow from Justice for Girls, who's had connectivity issues. So instead we have Annabel Webb, who's joining us. Thank you, Annabel, for graciously being on standby today. Annabel is the president and co-founder of Justice for Girls. Zoe Craig-Sparrow, who is going to speak, is an Indigenous woman from the community and family, the Musqueam people, and she works at Justice for Girls, which is why Annabel has stepped in. Annabel is the president and co-founder of Justice for Girls. In addition to Annabel's multiple degrees and current pursuit of her PhD, she has worked for more than 2 decades as a human rights practitioner, promoting the rights of women and girls across a broad spectrum of social, economic, and environmental justice issues. Annabel is also the proud mother, I assume, and litigation guardian of one of the plaintiffs in the LaRose case, a recent court challenge about Canada's emissions of greenhouse gases, a case that we'll speak to a bit more shortly. We have 2 other speakers with us. Dr. Ann Hicks is an assistant professor in pediatric respiratory medicine at the University of Alberta. Her areas of interest focus on the influence of the environment and individual responses to specific exposures, particularly with respect to asthma. She is also the clinical lead for the Children's Environmental Health Clinic, which provides clinical service, research, education, and services, including contributing to the World Health Organization as a collaborating center. Our third speaker is Nicholas Rees. He's joining us from afar. I'm so glad you're able to join us, Nicholas, and I believe it's the middle of the night for you. This is great. Nicholas Rees is a climate and environmental specialist at UNICEF headquarters in New York. He is a global expert in analysis, strategy, and advocacy for children and environmental issues, and has supported UNICEF's growing work in this area. He is the author of various global publications that examine the environmental determinants of children's health and well-being, including The Toxic Truth, Danger in the Air, Clear the Air for Children, and Unless We Act Now. Thank you so much for all of you to be able to join us. I think we're going to allow each of you to start with a bit of an opening, and the order we're going to proceed in is Nick, we're going to have you go first, and then Anne, and then Annabel. So we want to start now with Nick. Thank you.
Thanks, Emily. I will just share screen. Give me 1 second. Is that working okay?
Yeah.
Okay, awesome. You can see the screen, right? The slides. The climate crisis is a child's rights crisis.
Yes, we can. Thank you.
Okay, great. So firstly, just to say it's a real pleasure to be here. And most importantly, thank you, Sarah, Leila, as well, for those really illuminating opening remarks that you shared with us, your stories. I think incredibly inspiring. I'm sure that they're not only inspiring us, but many other people, children, young people, adults around you. And so keep up the great work, because those were fantastic. We need more people like you in the world. I'm going to start by kind of a little bit of a scene setter. UNICEF, as Emily mentioned, I work at UNICEF based in New York, currently in Australia. And we work in almost every country around the world, responding to all a wide variety of threats that children face, but the growing threat of climate change. UNICEF has been on the ground in almost every country globally for many, many decades, starting in the 1940s. And we've seen the changes firsthand. It doesn't take it doesn't take detailed scientific analysis for us to know what is happening in a lot of these communities. We've seen them happening over the last few decades, and we can say with absolute certainty that the climate crisis is already impacting children. It's not just something about the future. And so we're scaling up a lot of our programming and our response to help children and young people respond to the climate crisis. Earlier this year, we published a new global report called "The Climate Crisis is a Child's Rights Crisis," because that's increasingly what is at stake here. This isn't anything short of that. This is affecting all of children's rights. It's affecting their access to education. It's affecting their access to health. It's affecting their access to water and sanitation. And so what this report aims to do is identify where children are most at risk. But let me just also start by saying that children, they're not small adults. They're not just small, climate change impacts children differently than adults. In many ways, they're actually more vulnerable. Children are, especially very young children, are less able to physically withstand a lot of the impacts of floods, of droughts, of severe weather. They're also physiologically more vulnerable. Exposure to harmful toxic substances such as lead or air pollution impacts children more than adults, even at lower doses. It can affect growing organs that are growing rapidly at a young age. That will have impacts on children for the rest of their lives. Studies show that diseases that climate change are most prone to spreading, such as malaria and dengue, those are also, they impact children more than adults. About 90% of the global burden of disease associated with climate change is borne by children under the age of 5. And finally, children have their whole lives ahead of them. So risks, deprivations, climate impacts now can have a lifetime of impact. So in all of these ways, children are more affected than adults. And I think that's a really important thing I want to start out with here, because these impacts are different. And so it's also important to note, though, that children have the inspiration, vision, the innovation, and their incredibly strong drive for change. The power of children and youth give us, and certainly me, hope for a better future. So quickly, what does this report tell us that we published earlier in the year? To start with, about 1 billion children, that's nearly half of all children globally, live in extremely high-risk areas. They face exposure to multiple climate and environmental shocks, as well as they don't have the capacity, resources, and access to key services that would make them resilient. And so this index is really kind of the first truly child-focused view of climate risk, not just looking at a range of shocks and hazards and environmental shocks, but also how children are vulnerable and susceptible to those hazards. Do they have access to health and healthcare and education and water and sanitation? Access to these really helps determine the scale of the impact that a climate shock will have on a child. And in a nutshell, really, this report tells us which countries children are most at risk in. It tells us the likelihood of a child being able to survive climate impacts in those places. And so you can see that in the map there, the most high-risk places. But also, interestingly, this report also tells us that the most at-risk children really contribute least to the causes of climate change. The top 33 highest risk countries in that map contribute only about 9% of global greenhouse gas emissions. 9%. If you looked at just the top 10 most at-risk countries in the map, they would only contribute about 0.5% of global greenhouse gas emissions. This really just drives home the point how incredibly inequitable the impacts of climate change are. Those who contribute, well, children certainly contribute least to the causes of climate change. Children in the countries most affected by far contribute least to the causes of climate change, yet they'll bear by far the greatest burden of the impacts. So the report also takes a deeper look at some specific risk factors. It's a data-driven report. We look at how many kids are exposed to shocks and stresses such as heat waves. About 820 million children, that's a third of all children globally, are exposed to high levels of heat waves. 400 million children highly exposed to cyclones. 330 million children highly exposed to riverine flooding. And these are incredible numbers that also, provide us with some evidence on where these impacts are taking the greatest toll. We also look at how many kids are exposed to not just, one climate environmental shock, but potentially more than one. To start with, almost every child on Earth is exposed to at least one of the climate and environmental hazards, shocks, or stresses that we looked at. But about a third of children are exposed to up to 4 or more of these shocks and stresses. That's air pollution potentially at the same time combined with heat waves, combined with potential for flooding, and all. You might ask, what does it mean to live in a place with so many overlapping hazards? Often these hazards can trigger, reinforce, and magnify each other. So we know, for example, that being exposed to severe weather and cyclones at the same time as sea level rise creates those deadly storm surges. So being exposed to more than one is often worse than the sum of their parts. This is a map where we've looked at the number of kids that are exposed to more than one. And as I said, about a third of all children globally are exposed to 4 or more at the same time. I'm going to just go into our calls for action because I'd like to keep the discussion going, and we can, for the Q&A. But let me just start by saying it's painstakingly clear that children's voices from the most at-risk places are not being heard. We need to listen to children, to the voices of all children, in particular those from countries extremely affected. Only then will our climate policies and responses be truly fit for purpose. And we need to give children the best possible chance to survive and address this crisis, a crisis that we have bestowed on them. We need to reduce emissions, that's absolutely critically clear. We need to invest in adaptation. Children are already suffering, already dying due to the impacts of climate change, due to emissions that have already been emitted. Many millions more will suffer in the years to come, and we need to invest in adaptation measures now to save those children's lives. We need to make sure children have the resources and skills necessary, so climate education and skills that are suited to a growing green economy, so that they can not only respond to those impacts, but also be better positioned to develop the innovations and the solutions necessary to address the crisis. We need to listen to them. We have a responsibility to take action on a scale that's commensurate with the scale of the problem. We need to listen to children and young people and hear from them. Sorry, I didn't go in order on these calls to action. And finally, we are also calling on governments to ensure that the recovery from COVID-19 is green. We have an opportunity now to embark on a new path globally on this. We can address the COVID crisis at the same time as shift our systems, shift our economic systems so that they are more sustainable, and we're on a better path for a livable planet for future generations. I will stop there.
Thank you so much, Nick, for your introduction. That's really interesting, and we're looking forward to having time to discuss all of that a little bit further. So I'm going to move it over now to Anne, if you want to join us and turn on your, unmute yourself, I guess, so you can join us.
Thanks so much, and I'll just take a second as well to share my screen, and there we go. Can you see the screen okay? Perfect, thanks. So I wanted to first of all say thank you so much, Nicholas, for bringing the broad picture into view, and really also very much thank you to Sarah and Layla for your like really inspirational writing. I'd also like to acknowledge that in Edmonton, I'm speaking from Treaty 6 land, as well as the homeland of our Métis and other Indigenous peoples. And I wanted to bring us from the big picture down to the lens of a single patient, or the lens of a single human, really. I'm speaking as a pediatric respirologist, and so I'm going to focus on air pollution and air quality as my example of climate change and its impacts on children's health. Yeah, so I'll quickly swing past the intersection between air pollution and human health at the level that I think about it from a patient perspective, and bring you the view of one of my patients that really opens the door to understanding, you know, we think about vulnerable populations, and globally we see that a lot of people really don't have control over what they're exposed to. But it's a little bit harder, I think, sometimes to think, just as Sarah and Layla pointed out, there's people in your school that experience racism every day, and we might not see that. There's also people in your school that experience the health consequences of environmental exposures every day that we don't always see. This is actually a picture of a beautiful river valley on my way home from work, looking across a big valley to a wooded hillside, which, as you can see on a wildfire smoke day, isn't awesome. So I wanted to start by talking about particulate matter, which is really what we think about when we think about air pollution. Particulate matter in the air comes from a lot of different sources: smoke from wildfires, exhaust from vehicles, and even things like any kind of power generation where you're burning a fossil fuel to heat your home or run your air conditioner or anything like that. Allergens are a big deal for my population. Dust and viruses like COVID are also particulate matter in their own special way. My dog produces a lot of particulate matter, and he likes to walk people through a lot of my talks. Yeah, and so particulate matter size is one of the very important things about particulate matter. What you can see sits around 10 micrometers, and I think about very small things, and when you think about very small things going into your lungs, your particulate matter at that size, you can see it. If you're out in the dust, you're breathing it. If you blow your nose, it's the gray stuff that gets stuck in the boogers. And it can give you a really sore throat and irritated eyes, especially if it's coming from wildfire smoke or traffic pollution. Once you get down to what we call PM 2.5, which is a really important size of molecule, it can go deep into your airways, into the place where oxygen gets into your blood and air comes out, and it can cause a lot of problems there. And if it gets all the way down to 0.1 microns, it's actually little enough that you can absorb it directly into your bloodstream if it lands on your respiratory mucosa, which is my doctor word for the skin inside your lungs. This is my dog when he was a puppy. He's a big dog. Basically what I think about when I think about particulate matter and what happens when it gets into your lungs, first of all, just being there is irritating. It's like getting sand in your eyes. Even if you're not allergic to getting sand in your eyes, it's pretty irritating. And inhaled particles land on our mucociliary ladder. That's the mucus that your lungs make in order to help clean. It captures that particulate matter, and then you have little hair cells in your lungs that beat. They all do the wave like at a baseball game or something, and they move that particulate matter up and out of your lungs so you can cough it out. It's a big part of your innate immune system, meaning not the vaccine mediated part, but the part that just kicks everything out if it falls in your lungs, which are meant to be clean. Particulate matter can be irritating as well, and specifically reactive oxygen species, oxidizing agents, things like ozone, can cause damage directly to your skin of your lungs and to the different parts of them. You also make a huge inflammatory response to all these irritants down there, and then your body starts attacking the irritants, and it can accidentally attack you at the same time. That's where a lot of allergy and asthma comes from. And some of the things that you breathe in are actually toxic as well. And they have effects like killing the cells in your lungs. We know that having any of these particles present in your system decreases your ability to fight off bacteria and viruses. And we know that air pollution impacts your ability to fight off COVID and makes you have a worse outcome. So all of those people that you saw in the map that Nicholas showed, who have higher levels of exposure and less control over their exposures, are going to have worse outcomes with COVID. And that brings me to one of my patients who has been speaking publicly for several years now about the impacts of things like wildfire smoke and air pollution on health. Here she is holding her personalized asthma action plan, and she has severe asthma. She can spend up to half of her summer holiday shut in her home because her family doesn't have air conditioning. It's pretty warm in there with all the windows and doors shut. She can't go outside and play. She's isolated from other children. And so already you're looking at somebody who has a disproportionate impact of environmental change because of her asthma, okay? And that happens a lot for my patients. If you're exposed to high levels of air pollution, you have more of a chance of ever getting asthma, more of a chance of having asthma attacks on a regular basis. And so she's just the canary in the coal mine. Every single child at her school is impacted by air pollution, but it impacts her to the point that she misses school and misses other things. And you can read her news story and find her in other places on the web because she's been brave about speaking out about some of the impacts. And when she shared things at school, it actually has decreased some of the isolation that she experienced because people used to leave her out. She couldn't play with other people, and then they leave her behind. After she showed why she gets left behind, people include her. And they'll say things like, oh, hey, are you short of breath? Do you want to play goal? Do you need your puffer? So we're actually changing the conversation around some of these disabilities. And what do we do as grown-ups? You know, how can I help these people? As a doctor, I'm the practical pig. I'm not going to be the person who can decrease wildfires. I'm not going to be the person who can make the smoke better. But if you use some of the tools that we do have, we can decrease the impact on children. One of the things is the Air Quality Health Index. You can download that from the Canadian government website for your iPhone or Android phone. And you can actually set it. It's automatically set, so it pings you at an AQHI of 7, which is when any person should stay out of the air because it's going to be harmful. However, infants and young children, as well as people with significant asthma problems, should actually start staying out at around 4. And one of my other patients made a cultural change at their daycare because they weren't able to go outside and they kept missing school because they'd have an asthma attack when they had to go outside. So they said, hey, babies shouldn't be outside either. So instead of going outside with their class, they go and help in the baby room now, and the babies stay inside. And it's that person's responsibility to help the daycare know which days people shouldn't be outside being exposed to poor air quality. Again, this isn't great. We haven't fixed the air quality, but at least we're protecting the health of our most vulnerable people. So I wanted to end, even though this is a sad note, and our Children's Environmental Health Clinic actually has an art gallery where we encourage kids to express themselves with any form of art about positive or negative impacts. And this is one of our the entries in the art gallery. It's named after Dr. Irina Buca, who founded our clinic in 1990s. Basically, you know, children tell us what they need. Children are a great motivator for change and a huge reason that we make changes. when we start supporting children, we're able to make change person by person, but also at bigger levels. And we really need to continue to do that. Thanks so much for letting me speak today. I appreciate it.
And thank you so much for sharing that opening with us. I found that really interesting as someone who does have some respiratory concerns myself. I really liked learning about that. I do worry about children in that aspect quite a bit. So I'm looking forward to talking to a little bit more about what we can be doing and what the government needs to be doing shortly. But first I want to bring back Annabel and ask her to speak as well and introduce to us to a little bit to the big picture, a little bit about hope. And I'm going to turn it over to you. So Annabel, please feel free to unmute yourself and speak up. Thank you.
Thanks so much, Emily. And thank you for letting me jump in at the last minute here to stand in for the wonderful Zoe Craig Sparrow. And I hope I can live up to what she would have presented today. And I just wanted to acknowledge that I'm speaking today from the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. And I'm very grateful to be here in Vancouver on a very rainy day. And also thank you to Sarah and Layla for sharing such wonderful and inspiring writing. And also to Anne and Nicholas for really setting the stage here. Much of what you presented are areas of concern to us at Justice for Girls. I'm really wearing my Justice for Girls hat today in speaking to you, and I'll just tell you a little bit about the work that we've done at Justice for Girls over the years to look at the specific and disproportionate impacts of environmental harms and climate change on the rights of teenage girls, and particularly the rights of teenage girls who live in poverty. That has been a focus of our work since about 2012 now. And just to give you a little bit of background on Zoe Craig Sparrow's participation in our work, Justice for Girls is an organization that really believes in co-leading with girls and young women in the advocacy that we do from the very foundation of the organization to the systemic advocacy, specifically in relation to climate change. Zoe Craig Sparrow joined us when she was 12 to work on some advocacy with us and ended up doing a joint internship with us and the David Suzuki Foundation in really documenting and understanding the relationship between children's rights and climate change, and taking that analysis and turning it into a submission to the Committee on the Rights of the Child when Canada was up for review by the committee in 2012. So we've been doing this for quite some time and really trying to understand specifically in Canada, but also globally, how climate change impacts girls, particularly, as I said, those who are vulnerable by virtue of the fact that they live in poverty, the disproportionate impacts on Indigenous girls, and trying to hold Canada accountable for not only policy failures, but active participation in the increase in greenhouse gas emissions connected to the continued development and expansion of the fossil fuel industry in Canada. So the organization has done this sort of systemic level advocacy, both in 2012, Zoe and another young woman, Reka Dillon Richardson, traveled to Geneva, met with committee members there and attended the session and had an impact there. And then more recently, we have again gone to the Committee on the Rights of the Child, making a joint submission, a coalition submission actually, but also bringing two young women to meet with the committee last October in preparation for Canada's review coming up in 2022 now. In that advocacy, we brought forward two girls who are two of the LaRose plaintiffs, the climate case that's currently in the courts including Hannah Edenshaw, who is a Haida young woman, and Zoe Webb, who happens to be my daughter and is also one of the plaintiffs, to really inform the committee about Canada's failures and Canada's not only omissions, but acts in relation to violations of their rights, particularly rights to life, and also equality under the Charter of Rights and Freedoms. So I think that really the focus of our work is to make connections between the international human rights framework that is really a tool in domestic advocacy to promote the rights of teenage girls, and really do make the connection between human rights and the environment. At the moment, I don't think you mentioned in the introduction, but I'm currently a fellow at the David Suzuki Foundation. I'm the Environmental Rights Fellow, and a lot of my work is focused on ensuring that the interpretation of the rights, on children's rights under the Charter of Rights and Freedoms in Canada contain environmental protections as part of the scope and content, particularly of the right to life, liberty, and security of the person, and bringing in international norms where that has been established. So I've done a fair amount of work looking at the right to life internationally and doing advocacy systemically to expand the interpretive framework of those rights to ensure that environmental protection is an obligation of the government as part of protecting children's right to life. So, and in the LaRose case, of course, the fight that we will have with the government is about the interpretation, particularly the scope and content of the right to life, liberty, and security of the person. So we're very much connected and engaged on the LaRose case. And we also make the connection between ecocide and genocide. Our work is very concerned with the genocide of Indigenous women and girls and how environmental harm and particularly oil and gas development is connected to that genocide. And so within our intersectional understanding of the disproportionate impacts of environmental harms and climate change on girls, particularly those who are Indigenous, we try to frame our understanding within the concepts of ecocide and connecting to the genocide of murdered and missing Indigenous women and girls. So I think we'll get into a discussion about the LaRose case, and I'm happy to speak about my experiences of that with a front row seat as litigation guardian to my daughter. What I can say from the outset, and just even in the beginning of this conversation, it's really difficult work. It's very difficult to face these issues and to see the impacts that environmental harms and climate change are already having on the children in our lives and in our communities. So I thank you very much for making this the focus of the discussion today. And I look forward to chatting further in our discussion component.
Annabel, thank you for that. And thank you for the introduction to the LaRose case, which we do want to chat a little bit about. And as a lawyer, I also have the folly of falling down the rabbit hole of nitty-gritty on the legal aspects. But we did want to spend a little bit of time today talking about, so for those of you, I think Annabel did a great introduction to the LaRose case, but just to let everyone know, it was at the federal court. It's on appeal right now. And at the federal court, they did dismiss the claims being made. So it is going to be a question of whether the courts are going to accept some of these arguments or not. So outside of that, though, we did want to talk also about, what is the responsibility of the federal government, regardless of whether they're held on a legal standard or not, and breaching a charter of rights, but like, what is the responsibility of the federal government? What is the responsibility of the provincial governments? How are they going to work hand in hand? And so maybe if you want to start with that, Annabel, and then I'll invite Anne and Nicholas to jump back on screen and join us as well and contribute any commentary they have on this question. That would be great. Would you like to start us off, Annabel?
Sure. I mean, first and foremost, I think we have to look at fossil fuel development and expansion. We have a government that clearly believes in the expansion of fossil fuel development in this country. And from our perspective, any expansion of fossil fuel development is a fundamental violation of the rights of children's right to life, survival, and development under the government's obligations under the Convention on the Rights of the Child. So, and I would argue also their obligations under the International Covenant on Civil and Political Rights on the right to life. So, you know, our starting point is we need to stop the acts, the government acts that are contributing to climate change. That is a fundamental point. So we need to, and you know, obviously COP26 here is the message is we need to stop fossil fuel development. We particularly need to stop what we refer to as extreme energy extraction, which would be fracked gas and anything that comes out of the tar sands, that sort of extreme energy, which is extremely carbon intensive and just simply does not fit with the kinds of greenhouse gas emission reductions that we need to make in order to turn this around for the sake of children and future generations. So we rest very firmly there, but also that the government needs to fulfill its obligations under its international commitments to these human rights treaties. And within the international arena, people are increasingly understanding that those international human rights obligations contain obligations to protect the environment. And so most broadly, I would start there.
Thank you, Annabel. Nicholas or Anne, do you want to step in and talk a little bit about the obligations or responsibilities of the Canadian government and the provinces at this point?
Over to Anne, I think.
Okay.
Yeah, the obligations of the government is always a hard one because, you know, you wonder what you can do to make an influence. I think from our perspective, standing on it from the medical side, as a pediatric specialist especially, one of the things that I think is really important, first of all, is capturing the voices of our children with their words and also with their health. So there's some great studies that show, for instance, California did a lot of work to decrease emissions and have emissions controls. And a more than 20-year-long study on children's lung function carried out in different districts in California during that period show that there's an increase in lung volume and an increase in lung function independent of all other factors in children when you see a decrease in some of the major pollutants in the air. And evidence like that is something that we can all take to our governments as important and useful information that will help them actually control. Like it's a really good argument for emissions control. And it's a really good argument for some of our fiscally conservative governments to say, hey, this is going to cost you a lot less money at the end of the day when you have a healthy population than having sick people and getting a little bit of extra money off royalties in the short term will gain for you. So I think we can make some of those not very humanitarian, but entirely practical arguments, as well as making the humanitarian arguments that it's just absolutely wrong for children who should be growing up as healthy as possible. All children have the right to health and happiness and should grow up without medical complications if we can possibly help it, right? And doing things that take that away from children is just the wrong way to be. But I think we can make the arguments in many different ways. And I think we have to if we're going to have an impact on policy.
I think all of your contributions to the growing body of evidence is really going to be helpful. It's going to support any actions as well as advocacy and within the legal sphere as well. I think it's going to make a big difference. You know, I think one of the big questions for all of us is why are there so many barriers to change? What are those barriers to change? And what's it going to take to try and overcome some of those? I can't imagine that trying to fight all of this out in the court system is going to get us somewhere quickly, and that's part of the challenge. So I guess that's a question I don't know if any of you want to talk about a little bit, is, you know, what are these barriers to change, and whether you have some thoughts on how to address some of them.
I'm happy to come in here. I think a lot of the barriers I think that we're talking about in terms of children being structurally vulnerable, they're related to a lot of the same barriers that we face in terms of reducing vulnerabilities and why it's so challenging. I think they're very related to growing levels of inequality within countries, within communities. The poorest children are not getting access to the same resources as the wealthiest children. And climate change is exacerbating these inequalities. The poorer child is less able to cope, less able to withstand the impacts of climate impacts, the floods, droughts, severe weather, heat waves. They don't have access to key resources and services that can help better protect them, such as clean water, food, health facilities when crises occur. And I think that this pushes them further into poverty. Wealthier children, meanwhile, have access to a lot of these resources that even if crises negatively affect them. So, you know, and I kind of mentioned this in my presentation. This is the inequality is having an impact on well, climate change is an incredibly inequitable process, pushing the poorest further into poverty, and at the same time, inequality is also driving our inability to address a lot of the impacts and come up with and have these solutions globally applicable.
Thank you for that, Nick. Annabel, do you want to jump in there?
Yeah, I'll jump in there. I mean, one of the biggest, one clear barrier to change is that, unfortunately, those who are in control of the political arena aren't necessarily listening to those who are most marginalized and paying the heaviest price. They are tending to listen to those who are making economic arguments that are about continuing in an economic model that is fundamentally about inequality and based in inequality and environmental destruction. And so, you know, we have an ideological problem and a problem of those who are most impacted not having enough political voice, including children. And what we're seeing, I mean, I don't know how it is in all of your lives, but I think if we allowed the children to determine the outcome of an election, we would see a very different result, particularly with respect to the environment. And unfortunately, children don't have access to the vote. And this is one of the reasons for the LaRose case. And one of the arguments is that because children don't have access to the vote, they're either left to march in the streets or try to use the courts to make change, both of which are tools in a vast range of tactics to try and make social and environmental change. And I don't think children think that their legal case is going to magically change the whole system, but it is a way to try and push the government and bring profile to the issues and give them a place where they can actually have a focus of their concern and worry and passion and drive to make social change. So I think, within all of the strategies for making social and environmental change, these are some of the tools. And there are real barriers in terms of the what human rights and defenders and land defenders are up against in trying to literally stand and protect some of the areas of land and against industrial development that are in the way of the activism surrounding this globally. I mean, the numbers on violence and murders against human rights and particularly Indigenous land defenders are shocking and extremely disturbing. So I think there are a lot of barriers here for children. The lack of access to the political arena, having a vote, of course, makes a difference. But I think children have become incredibly creative and vocal in we see the global movement. It's incredible. So.
Thank you, Annabel. Anne, did you want to add anything to this topic?
I think a lot of my influences are much more on a personal than a global level. But I think that in that sense, children speak with their, they walk their talk. And I think that we as adults can also walk that talk. I've definitely changed my behavior. And I think we can spread it larger. For instance, the American Thoracic Society's Environmental Health Policy Committee analyzed the carbon footprint of their annual general meeting. We haven't made big changes other than that it was virtual because of COVID. But going forward, the actual entire annual general meeting, which is one of the biggest in the US at over 15,000 attendees at a small conference, now has an option to purchase carbon offsets for every meeting attendee. So I think, again, we're not fixing anything, we're just buying carbon offsets, but already exploring different angles at which you can decrease the footprint of the meeting, decrease the swag that you take home, things like that. So there's a lot of different places where you can start. And by setting your example, by walking the talk, you can actually influence others. And if you influence enough other people, then you can probably make inroads into things. Certainly when my patients tell me I should eat less meat or take the train more, and I do take the train to work, I hear them. And when our patients ask for virtual visits so they don't have to drive 8 hours from Northern Alberta to Edmonton for 5 minutes with me, we hear them. And we make a big difference when we make those changes. And we tell the government, hey, it's cheaper this way, support us, and we can push for change.
Thank you for sharing some of your thoughts on how adults can also work with young people. That was one of the questions that we had. And we have run a little short on time. I'm hoping all of you can stay for a few more minutes and answer one final question. And the big one is, what gives you hope? What gives you hope when it comes to climate action and the results and the impact on children's rights in that context? Maybe I'll start again by going in the same order. So Nick, do you want to jump in there and let us know a little bit about your hope?
Sure. Well, I think there are a lot of room. There is a lot of room for hope, and there are a lot of forces driving a lot of change. And we've seen prices of renewable energy start to go down, and we've seen, you know, new technologies and innovations. As I mentioned, I think the world has learned from COVID. Unfortunately, I don't think learned enough, anywhere near enough, but I do think that it has at least illuminated a different path to a lot of people. And so I think that gives me a lot of hope. But I think ultimately it's the power of children and young people already in this movement. Children and young people have raised the bar, they've raised the alarm on this issue in a way that we adults have failed. They are coming up with solutions. They're demanding change, but they're implementing the solutions within their own communities as well. I think that gives me tremendous hope, and I really feel like if the world acted, if the world thought and acted like young people, we would be in an entirely different situation right now. We'd be much closer to a solution than we are now. So let's try and be more like them, because they certainly give me hope that maybe we can alter the course of this crisis.
Thank you, Nick. Annabel or Anne, do you want to jump in there?
I can jump in.
Thanks, Annabel.
Yeah, I mean, I agree with Nicholas that a lot of my hope is seeing just how intelligent and motivated and capable young people are. I mean, in my work with young women, I've seen that across many issues, whether it's responding to poverty or violence against girls and so on. It's always very inspiring to see how resilient and smart and motivated young women are in response to those struggles. In this one, it's amazing. The kids who are the plaintiffs in the LaRose case are just a fantastic group of kids. We have met with kids from the Juliana case. I mean, these young people just need to be given the floor, you know. And so I take a lot of hope in that, but I also feel a lot of responsibility as an adult to ensure that my activism is keeping up with theirs, because we are all responsible and we cannot leave it to kids to fix this problem. It's not their responsibility to do so. So I say that acknowledging that we all have a very deep responsibility to take action in every way we can. So I'm hopeful, and I'm hopeful just seeing the unity amongst groups who are rising up and going to climate marches. You really see the unity of who's stepping forward. And I do find a lot of hope within in working with my Indigenous colleagues, and I'm extremely grateful to them for the shift in my thinking about our relationship to nature. I take a lot of hope in looking at Indigenous rights frameworks, which fundamentally connect humans to the environment. We don't separate ourselves from the environment through those lenses. We are the environment. And so for me, there's a lot of hope in really shifting thinking and repositioning ourselves within ecosystems, as opposed to extracting the human experience somehow outside of our own environment. So I do find hope in thinking about the world through that lens, and seeing that way of thinking is gaining far more traction than it has in the past. And as I say, I'm very grateful to my Indigenous colleagues and the leadership of Indigenous peoples to push our thinking, and that makes me hopeful. So yeah, I think that's it.
Thank you. And Anne, I'm going to turn to you. Maybe might be the last final word from our panel. You can think about whether you have a final sentence or two you want while Anne is speaking. That'd be great.
Yeah, no, I want to echo that. I have the same sentiments, and I really think that, like so many things where there's a problem there that's, we've made it, we have to look to the people we're impacting for inspiration on how to come to the solutions. Because at the end of the day, it doesn't matter what I want, it's what my children and grandchildren want that I should be working towards in order to help them. And so I'm really grateful for the children in our lives who inspire us to do a better job and who inspire us to try and help others build the right things to improve climate change. I agree that it's not their responsibility to fix things, but I feel like it's our responsibility to hear their wishes while we work towards fixing things, as opposed to, hey, we broke it, now let's make my solution be the solution that we choose, as opposed to finding the solution that fits for the people that are inheriting the broken thing.
Thank you, Anne. Okay, so I don't know if we have any questions from the audience. Hala or Kate, let me know. I know we're running really tight on time now, and I'm grateful for all of you to be able to stay on with us. Kate or Hala, do you want to jump in and let me know if you...
We do not have any questions from the audience. We have a few comments, but there are no questions.
Okay,
If
great.
anyone has a final question, we can take it, I think.
And in the meantime, I have invited Nicholas and Annabel to think about, or Anne, if you want to jump in back in, if you had a final words before we wrap up. I'm very grateful for everything you've had and shared with us today. So thank you again. But if you want to jump in for anything final, please do so now.
Well, I just wanted to say thank you for having us to speak today. And again, thank you so much for making this topic the focus of the conversation today leading into your AGM. I think the more we talk about this, the more we write about this, the more we, everywhere and anywhere we can continue to discuss this and change the conversation. It is a very good thing. So thank you for the opportunity today.
Likewise, just expressing my thanks. I think these conversations are super important to get this agenda moving further and faster because it is so critical. So thank you. And I think also, I think one thing that's very clear to UNICEF in particular is that we've been working to reduce child mortality for many decades, and we're not going to be successful in that endeavor. We're not going to get to zero child deaths, preventable child deaths, unless we address climate change and environmental degradation, and that's painstakingly clear. So thank you for this, and looking forward to continue to work with you all on it.
Great. Thank you, all of you. Oh, sorry, Anne, did you want to jump in there?
I just wanted to say thank you as well.
All right.
Yeah, great. Fantastic that you're doing this.
Absolutely. This is not just a one-off panel. It's an ongoing work of CCRC and everyone, all our members and many other organizations and people and all the children and youth activists out there. Big applaud to them in terms of leading us in that right direction. So you're more than welcome to stay for the AGM itself. In the meantime, I just want to thank you. Big hands. I can see some hands going in the chat there. So again, thanks again, and please feel free to stay. I know, especially for you, Nick, you might want to go back to sleep. So we understand, and really gracious to all of you for spending your time with us today. I'm going to turn it over to